Hi everybody and welcome to the first attempt at a podcast, and this is all on the management of chronic lower back pain, Pilates versus strength training, and is one better than the other? So if you look at all the information out there, you may think the case is closed, and we've seen headlines that Pilates is better than resistance training or resistance training is better than Pilates. But if we look at the data, specifically the major network meta-analyses from the last few years, the answer is more nuanced than a simple yes or no. So first, let's give credit where credit is due. The evidence is very clear that Pilates is helpful for the management of patients' lower back pain in the chronic setting when compared to no treatment, minimal intervention, or usual care. The Yamato and colleagues 2015 Cochrane review confirmed this, showing that Pilates produces clinically relevant improvements in both pain and disability for chronic lower back pain in the short and intermediate term. More recent reviews like Yu et al. 2024 have backed this up, consistently finding that Pilates beats doing nothing every single time. The latest review occurred by Cochrane in 2025 on the non-pharmacological management of patients with lower back pain also reports the same findings for Pilates, but their information is all taken from the 2015 Cochrane review on Pilates. But the real question is not whether Pilates works, it's whether it works better than traditional resistance or strength training. And this is where the gold standard narrative hits a statistical wall. When we look at direct and indirect comparisons, such as the network meta-analysis by Fernandez, Rodriguez and colleagues in 2022, a fascinating pattern emerges. While Pilates often ranks with the highest probability of being the best, sometimes as high as 98% probability for disability, that ranking is a bit of a mathematical illusion. It's a ranking of probability and not a measure of statistically significant superiority. When we look at the actual standard mean differences, also known as SMDs, the gaps disappear. So for pain, Pilates and strength training have nearly identical effect sizes. The overlap in studies like Liang et al. In 2024 and Fernandez Rodriguez in 2022, the 95% confidence intervals for both modalities heavily overlap and cross the line of non-significance. So in practical terms, this means that even though Pilates may be ranked first, it is statistically equivalent to strength training. There is no conclusive evidence that either is more superior than the other. This is a little chart I've just created trying to compare some of the results, but really showing that you can see that the confidence intervals, so we've got the small dot or circle, which is the effect size essentially, and the bars are the confidence intervals, so 95% confidence intervals. And you can see that on most they cross the zero line of no significance, but you can also see, especially in charts 2, 3 and 4, that the confidence intervals can and do overlap between the different modes of treatment, which essentially means there's no significant difference between the two. It's also important to note that this entire conversation is about chronic back pain. For acute low back pain, we actually have an evidence vacuum. The Cochrane review explicitly set out to find data for acute patients, but they couldn't find any eligible trials. So if someone tells you Pilates is the proven choice for a brand new acute back injury, the data simply isn't there to support that claim yet. So is one exercise better than the other? Statistically, no. They are both highly effective, active exercise options. If you are a clinician, the takeaway is that you don't need to choose based on an assumed superiority of one method over another. Instead, your choice should be guided by patient preference, access and cost, and adherence to their exercises. So the forest plots tell the story. The effectiveness of these treatments overlap massively. Pilates is a fantastic option to have in your toolkit, but it isn't a magic bullet that outperforms a well-designed strength program. I think both are great for patients with lower back pain. Thanks for joining me for this evidence breakdown and the first attempt at a podcast. And remember, keep looking at the confidence intervals and not just the rankings.